Hello, my name is Taylor Scarbin, and I'm going to be talking about what it means to be a physician assistant. First, we're going to look at some job characteristics of a practicing physician assistant. First, their median annual wages as of May of 2024. The average physician assistant made $133,260 compared to other healthcare professionals that diagnose and treat patients. They averaged $101,370. Compared to the total of all occupations, their median wage was $49,500. So there is a huge contrast in different wages, but the reliability, responsibility, and repercussions that can come of being a physician assistant, the stakes are higher. Typical responsibilities or duties of a physician assistant consist of recording patient medical histories, performing physical examinations, educating patients on preventative care, ordering and analyzing lab tests, and diagnosing acute and chronic conditions. They do other things as well, but these are, I would say, the top 5 responsibilities of a physician assistant. Traits and abilities that are required to be in this profession include self-confidence. You need to be able to make decisions and support yourself and explain yourself when you go to other professionals to speak for your patient. You need to have high organization and planning. That way, mistakes are less likely to happen. You need to be able to seek out resources, talk to other professionals, do whatever you need to do because lives are at stake. You need to be able to trust others, communicate very effectively, commitment to your patient. You need to have a strong work-life balance. You need to persevere when things get difficult and have extremely high compassion for your patients and for other professionals. This is not an easy career. As far as education, to become a physician assistant, you need to start with a bachelor's degree. You start with a 4 years degree. Then after you graduate from there, you go to PA school, and this is 2 to 3 years typically. First half of it, 1 to 1.5 years, is the didactic year, and then after that, it's followed by the clinical year. The didactic year is usually in a school setting, an educational setting. Then you move on to a clinical setting, which is actually in a hospital, or you're mimicking the career itself, but you're learning. So you still are a student, but you're being exposed to the healthcare field practically. As far as undergrad experiences, what can we do now? We want to focus on recommendations, building those connections. You want recommendations not only from faculty through your education, but also actively working physician assistants through the shadowing, through the volunteering, through the clinical hours. Following up with that, you want that patient care experience. That again can be shadowing, that can be volunteering, that can be working as an MA or a scribe or along those lines, EMT. You want to focus on, this isn't required for all PA schools, but some of them require the GRE test. That can be compared to like the MCAT. But you want to study for that, prepare for that to get the highest grade possible. You also want to be involved in leadership positions, either through extracurricular activities, through work, through your school, whatever it may be, to show that you are able to be depended upon, to take on responsibility. You also want to work on keeping a high GPA and keeping your grades strong as well. As far as work settings for a physician assistant, 52% of physician assistants work in offices of physicians. This can look like outpatient practices or along those lines. You're working with other physician assistants typically. 26% work in hospitals, either state, local, or private. 8% work in outpatient care centers. 3% in government, excluding state and local education hospitals. So this could be like a VA center. And then another 3% work in educational services, state, local, and private, such as schools, that sort of thing. As far as career projections, this field is expected to grow 20%. Others, healthcare careers, 8%, and total of all occupations, 3%. Thank you for listening.